been reported in association with the disease, and as is normal, sovereign countries investigate and respond to epidemics on their territory and request assistance from WHO as needed. We are always, and in every case when there's an epidemic or a new epidemic in countries, we always offer assistance, technical, operational and logistic as needed. In this particular case, and I think in the case of this response, I think Chinese authorities, as many countries around the world, again like Korea, like Japan, like so many other countries, have learned many lessons in the last 6 months in how to handle COVID all over the world, and I think have built significant capacity in doing that. However, we will continue to monitor the situation, continue to offer that assistance and continue to make information available to the international community as we do for all other countries. Maria?
Yeah. Case numbers, it was over 100 cases that we reported as part of the cluster. But just to say about are we concerned, we're always concerned for clusters. You know, in every country, in any country, wherever we hear of a clustering of cases, I mean, first and foremost, I should say every single case of COVID-19 is significant, and every single case needs to be followed up and cared for appropriately. But clusters are a special condition, because in any country, we need to understand why is there the clustering? What brought these cases together? Is it related to an expat dormitory? Is it related to a healthcare facility? Is it related to a long-term care facility or a school or whatever it may be? Because that will help us understand it and bring it under control. So any cluster raises our concern, as it does in all countries. And as Mike has said, we've seen officials take this seriously and do a proper investigation, as we are seeing in other countries that are seeing these cases. We are witnessing many countries apply the fundamentals of public health, of outbreak investigation, which public health professionals are trained to do, to find cases, to understand the extent of infection by doing active testing, and to follow up on all of the cases and contacts and care for anyone that is ill. My understanding is that there are no deaths associated so far, but of course, as Mike has said, we will monitor the situation as we do in all countries.
Further add, I think obviously these events are a threat in their own right, and no one likes to see them, but they do offer opportunities to understand disease transmission and to understand the circumstances and the context and the behaviours in which disease transmits more readily. And I would point you to, we've had some excellent articles come out in the last couple of days, one in the MMWR from the CDC in Atlanta, from Feroz and et al., Japanese colleagues who've done extensive cluster-based investigations looking for specific risk factors and specific situations and behaviours and contexts in which transmission has been generated in clusters. That's what we need to know. We need to have our scientists around the world investigating clusters, seeing what's driving infection. We have a lot of speculation around what's driving infection, what's causing this, what's causing that, and that's important. It's important for us to hypothesize. It's important for us to make models about what might be happening. But the answers lie in careful, systematic, exhaustive investigation of disease clusters to really look at what is happening in these situations and then what is causing amplification of disease in the human context. And if we get that, we will build up a much better picture of the public health advice we need to give our communities on what behaviours to avoid, on what places to avoid, on what circumstances to avoid, and for us in public health to have better policies to guide governments. So I do think this is an important issue in as much as it demonstrates that rapid response to contain clusters and systematic, thorough investigation of those clusters is both a public health act to stop the disease, but an act of public health discovery to understand how this disease transmits in these circumstances.
Next question comes from Pian, who works with the National Public Radio. Pian?
Hi, thanks for taking my question. I was wondering if you could clarify